Welcome to today's Explainer. Have you ever actually stopped to wonder what goes on inside your body when you take an everyday medication? We just pop a pill, wait around, and basically hope to feel better, right? Well, today we are taking a really cool micro to macro journey into the human body to unpack the science behind one of the absolute most common medications on the planet. We're talking about Omeprazole.
Okay, let's dive into this. Picture it. You've just polished off this fantastic, incredibly spicy meal, and suddenly, bam, there it is. This intense, glowing orange, fiery pain just radiating right up through your upper chest. That is severe heartburn. And man, it is miserable. It's not just uncomfortable, though. It's literally an alarm bell going off from your own anatomy.
So enter the solution, Omeprazole, often called the golden intervention. Now, this isn't just some basic run-of-the-mill pill. We're talking about a highly targeted medical intervention perfectly designed to stop that severe burn right at the source. So let's virtually travel inside the stomach and see exactly how this heavy lifting actually happens.
Section 1. The microscopic mechanism. So, slowing things down for a second, deep inside your stomach lining, you have these tiny, totally fascinating biological structures called proton pumps. You can kind of think of them as microscopic faucets, and their absolute sole job is to release acid to help digest your food. But when these little pumps go into overdrive, or when that acid sneaks up into your esophagus, well, they create that intense, fiery discomfort we just talked about. Basically, these proton pumps, they're the source of the fire.
And this brilliantly illustrates exactly how Omeprazole shuts down that fire. Let's walk through this fascinating sequence. First, the omeprazole molecules get absorbed and travel right through your bloodstream. Then, step 2, they find their way directly to those microscopic proton pumps, and they literally bind right to them. Step 3, just like twisting a faucet completely shut, the acid production simply stops. And finally, step 4, with that harsh acid gone, your stomach lining gets the peaceful, uninterrupted time it desperately needs to heal itself. The drug literally stops the problem right at the biological source.
Section 2. Healing the damage. Now, zooming back out to the clinical level, when you successfully halt that acid production, the relief you get is honestly incredibly versatile. Omeprazole brings fantastic heartburn relief, for sure, but it also allows these super painful stomach ulcers, which are essentially open sores in your stomach lining, to finally close up and heal properly. It's a go-to treatment for GERD or chronic acid reflux, and, get this, when you pair it with antibiotics, it even helps eradicate H. pylori. That's a really stubborn bacteria that can thrive in the stomach and cause immense damage.
Let's move forward and see how this builds into a truly dramatic physical transformation. Just picture an esophagus absolutely suffering from severe acid damage and irritation caused by GERD. It's inflamed, it's angry, but then look at the esophagus after treatment. The tissue is completely healed. It's beautifully restored to its normal, healthy state. The damage is essentially erased, which, as you can imagine, completely transforms a patient's quality of life. Stopping that acid really is absolutely crucial for long-term health.
Section 3. The morning routine.
Now, bringing this right into your own everyday kitchen. If there is one single number you take away from this explainer today, make it this one, 30 to 60. For this medication to actually work the way we just explored, you absolutely must take the capsule with a glass of water, exactly 30 to 60 minutes before your breakfast. Not during breakfast, definitely not after, strictly before.
So the crucial point is, timing is everything. But why? Why does this specific 30 to 60-minute window matter so much? Well, it's because those microscopic proton pumps we talked about, they're activated by food. If you take the medicine right when you eat, the pumps are already turned on and they're already pumping acid. By taking Omeprazole 30 to 60 minutes prior, you are giving those molecules the time they need to travel through your bloodstream, hunt down those pumps, and bind to them way before the food even arrives. It's like you're strategically shutting off the faucets before the water pressure even has a chance to build up. This simple morning routine is what makes all that abstract science completely actionable and highly effective.
Section 4. The fine print. Risks and side effects. Okay, let's take a very transparent, neutral look at the fine print and compare what can happen when you take this. First, you have the potential short-term effects. These are your milder, mostly gastrointestinal issues, maybe alongside the occasional headache. We're talking nausea, diarrhea, constipation, bloating, just general stomach discomfort. These might pop up as your body kind of adjusts to the medication. But then, on the flip side, we have something quite different. Long-term risks. And these are much more systemic issues involving your bones, your kidneys, and even your body's ability to absorb vitamin B12.
Now, what's really interesting about this is the biological reality of these specific long-term warnings. Because while omeprazole is absolutely a golden intervention, suppressing your stomach acid for years at a time, well, it can actually change how your body absorbs vital nutrients. And that can lead to weaker bones, kidney stress, or significant vitamin deficiencies. It's a pretty powerful reminder that, altering our biology always requires careful monitoring.
Which brings us right to the single most important takeaway of all. Use medicines only on your doctor's advice. Seriously, whether you're dealing with some annoying short-term side effects or you're keeping an eye out for those long-term risks, your doctor is the ultimate director of this whole medical journey. They are the ones who ensure that your healing completely outpaces any potential risks.
Wow, we've literally traveled all the way from the fiery discomfort of severe heartburn way down to the microscopic level of those tiny proton pumps, and then all the way back out to your everyday morning routine.